Hi everyone, welcome back. So for those of you who have subscribed to my channel, you may have seen that I've done a few other posts on the shoulder. So I've covered shoulder impingements, slap tears, specific muscles in the shoulder, also I'm now going to talk about shoulder dislocation, which is another thing that I see in practice. So shoulder dislocation is actually one of the most common injuries in contact sports, so things like football, rugby, and this is mainly because the shoulder is actually the most mobile joint in the body, which means that it can also be at risk of instability during those traumatic collisions. Now, there are three types of shoulder dislocation. So you've got anterior, posterior, and inferior dislocation. Anterior dislocation is certainly the most common, while inferior dislocation is really not so common. So I'm just going to go through and explain each of those types now. So the first type is anterior dislocation, which, as I've said, is the most common type. And that's where the humerus, which is the upper arm bone, forms the ball of the joint. So that usually sits into the glenoid cavity here, which is the socket of the joint. But with anterior dislocation, what happens is that comes out of the socket and pulls forward. And so if we look at this X-ray, you can see, the socket around here, and the bone is just pulled out and pulled forward. And so that is the most common type of dislocation. And the next type of dislocation is posterior dislocation. And so this is where the bone of the upper arm, the humerus, actually, again, it pulls out of that glenoid cavity, which provides the socket of the joint, but this time it pulls backwards, which, as you can see here, it pulls the arm, pulls the shoulder back. And again, if we look at the X-ray, you can see it's come out of the socket there, and it's just sitting back rather than coming, forward like it did in the anterior. And then we have the least common type of dislocation, which is inferior dislocation. And this is where the upper arm bone will basically come out of the cavity here, but it will be pulled downwards. With this one, surgery is usually the best option in terms of treatment. And again, if we look at the X-ray of an inferior dislocation, you can just see it's just dropped down, and it's not pushed right up in that socket. So as I've said, anterior dislocation is the most common type, contact sports are really where dislocations can be quite common injuries. Anything where you've got tackles, or where maybe you're going to fall onto an outstretched arm, which is going to put all the impact through that shoulder. Overhead possession and collisions, all of these things will increase the risk of a dislocation injury. Now, as I've just shown you with the pictures, dislocation of the shoulder means that the ball of that arm bone comes out of the socket or the glenoid cavity in the shoulder. And this not only puts the shoulder at a higher risk for repeated dislocations, and, in anyone who plays contact sports, you've got up to a 29% risk of a repeat dislocation in these contact sports. But also, it can negatively impact on performance. You may have a recovery time of around 6 months, although, some athletes will take a little less time. But also, as well as that increased risk of a repeat dislocation, it also increases the risk of injury in the opposite shoulder. Because obviously you're going to be compensating, so that's something to also watch out for. Now, the shoulder, which if you've seen any of my other videos, you'll know it is a complex joint. It's stabilised by ligaments, muscles, the labrum, which is that cartilage that surrounds the glenoid cavity or the socket of the joint, and the shoulder capsule. And dislocation can damage any of these structures, and also can cause a slap tear, which I've just done a video on slap tears, which is where that cartilage or the labrum is damaged. So do take a look at that if you think it's applicable to you. Now, the rotator cuff muscles also play a really important part in shoulder stabilisation. They counterbalance the power of those deltoids, which are the main bulk of the shoulder, and also the pectorals and the lats, which come down the side. So, any weakness, in those muscles can also increase the risk of injury. Now, if we look at, we've sort of talked about contact sports being a big factor in shoulder dislocation. So we're just going to take a minute to look at common, injuries in contact sports, because sometimes, a lot of the symptoms in shoulder injuries can kind of mimic other things. So obviously, we've got shoulder dislocation, what we're talking about today, where the ball and socket of the joint separate, often due to those strenuous arm movements or traumatic collisions that we've talked about, whether that be a collision with another player or a collision, with the ground and falling onto an outstretched arm. And so again, sort of just diagrammatic representation of shoulder dislocation. So here you've got a normal shoulder where the ball of that arm bone sits nicely in the socket of the shoulder joint. And as we explained, you've got anterior dislocation where it pops out and comes forward, or posterior where it pops out and draws back. So that's certainly one of the most common injuries. Now, there's also something called a separated shoulder, which is basically where you have ligaments that sit up here, which attach the collarbone or clavicle that sits across the front onto the shoulder joint. And so in shoulder separation, you've got a grade 1, where you can see there's a little bit of damage here to the ligament. You've got a grade 2, where probably a partial sort of tear in the ligament. And then you've got a grade 3, where the ligament there completely ruptures. So this is actually more serious, than dislocations. Now, you can also have anterior shoulder instability, which is basically where the ball part of that arm bone will just kind of slip in and out of the socket. And usually this is due to, sort of long-term, and repetitive throwing. So if you're sort of doing athletics, maybe you're doing something like a shot put or javelin where you've got that force as well, you may be more prone to this. And also, again, if you've had a dislocation, you're going to be more at risk of having long-term shoulder instability. Shoulder tendonitis is another injury common in these contact sports. So, and again, repetitive throwing can cause inflammation, of the tendons in the shoulder. Usually we're talking about the biceps tendon, which comes up and attaches at the top of that shoulder capsule onto the labrum or the cartilage. And again, if you've seen my previous video on slap tears, I show you exactly where that shoulder, that biceps tendon inserts. So slap tears, and that's another injury common in contact sports, which is basically damage to the top of that labrum, which is the cartilage that lines the glenoid cavity. But take a look at that video for that. Rotator cuff injuries, as we said, rotator cuffs, they're the four muscles that sit around the shoulder blade. They really help to provide stability to the shoulder joint. And so any inflammation or tearing in these muscles due to repetitive or excessive throwing movements, again, will cause instability in the shoulder. Another injury is internal shoulder impingement. Now again, I have done a previous video on shoulder impingement, so do take a look at that if you think it's applicable. And this is basically where you get pinching of those rotator cuff muscles, just at the top, at the back of the shoulder joint. Again, due to, repetitive overhead throwing or loose shoulder joints. There's various risk factors, so do take a look at the shoulder impingement video if you think that might apply to you. And also nerve compression can be an issue with that as well. So back to dislocation. If we look at risk factors, who is at a higher risk of having a dislocation, certainly males in their teens or 20s seem to be more at risk, or any athletes with an excessive range of motion, due to shoulder instability. So if they have like a loose ligament or capsule complex, that's going to put them more at risk. Contact sport athletes, as we've said, and particularly those with poor isokinetic strength, which is basically the ability of a muscle to contract at a constant speed. So anyone who has poor isokinetic strength in the shoulder may again be at risk of injury. Or also any athletes with asymmetrical rotational movement of the shoulders. That can also put you at risk. Impaired performance and or either trunk or leg injury. Research has shown that tackling fatigue may decrease the sense of the sort of shoulder joint position and therefore increase the risk of injury. As we said, it's very common in contact sports, so football, hockey, rugby, any sport, also with the potential for falls. So this could be something like downhill skiing or gymnastics or volleyball. Again, if you've got that risk of falling onto an outstretched arm where the impact gets forced through the shoulder, again, that is going to put you at risk. So, the causes of dislocation: collisions or sudden blows to the shoulder, which pull the bones out of place. Excessive rotation of the shoulder can push the ball of that upper arm bone out of the socket. So again, you're like throwing sports, that's going to be an issue. And as we said, falling onto an outstretched arm as well. Now, the symptoms of a shoulder dislocation will certainly vary according to which of those three types of dislocation you have. But certainly one of the most obvious is a visibly deformed shoulder, and that will be really quite obvious. The likelihood is there'll also be local inflammation and heat, bruising, and you're going to have a lot of pain. whatever type it is, it's going to be painful. You're going to have an inability to move the shoulder, and there's certainly going to be a lot of instability there in the shoulder joint. And you'll also have loss of shoulder proprioception, which is kind of awareness of where the joint is in space. You may also have numbness, weakness or tingling, either in the neck or down the arm, and that's if there's been any kind of nerve damage with the injury. You may have muscle spasms around the shoulder. You may even hear a popping sound at the time of injury, and certainly with any ligament injuries you always hear that pop. There may be sort of high muscle tone or overcompensation of muscles crossing the joint. You may also sometimes find that the tissue is actually quite cool. And this doesn't happen very often. It's really only in very, very severe dislocations, or chronic dislocations where it just repeats again and again, but the tissue may then become cool due to ischemia and lack of blood supply, basically. Now there are additional complications of a shoulder dislocation. So we're looking at things like a contusion, muscle strain, particularly those rotator cuffs, nerve and blood vessel injury, hematoma, maybe development of adhesions and excessive scar tissue around the joint as well, which is also going to, contribute to future sort of muscle tension and spasms and pain. Now, obviously, tearing of any muscles, ligaments and tendons that stabilise the shoulder joint, that's going to cause further weakness. Potentially a Bankart lesion, which I refer to again in the slap tears video, where you have damage to the bone socket, the ligaments and the labrum. Nerve or blood vessel damage around the shoulder joint. And again, if there's blood vessel damage, that's going to affect healing after the injury. As we've said, shoulder instability, if you have a severe dislocation or if you have repeated dislocations, you are really going to be at a much higher risk of re-injury. So how can you, particularly if you are someone who is in a contact sport or throwing, sports, how can you try to prevent the risk of a dislocation? So obviously ensure that you've got, any protective equipment required for that sport. For example, American football, make sure that your shoulder pads, are fitted properly. Because if they're not going to be much use. Undertake, for example, if you play football, undertake football specific training, strength training, so that you are adequately preparing your muscles and ligaments for the movements within that sport. Now, in terms of rehabilitation, it's very easy for people to get impatient because they, enjoy their sport so much, and too many people actually go back too soon. But actually, returning to sport too soon after a dislocation, all it does is increase the risk of it happening again. Simple dislocations may potentially be healed within a few weeks, but, there is still the recurrent risk of another injury there, because you're still going to have a weakness there and scar tissue, etc. So it is important, to do exercises to strengthen and stabilise the shoulder, and to ensure that range of motion is back to where it, was before you return to any sport. In terms of rest and recovery phase, you want to ensure that you rest the shoulder, avoid any painful movements, heavy lifting, overhead movements until that shoulder is healed. Using, as we said, ice and also heat every couple of hours for maybe 15 to 20 minutes, just for the first couple of days to help reduce inflammation and pain. When the pain and inflammation improve, you can use hot packs for about 20 minutes just to help relax those tight muscles, alongside obviously anti-inflammatories. And after a couple of days, you then want to start some gentle exercises just to maintain that range of motion in the shoulder, and also to avoid a frozen shoulder or muscle atrophy and rotator cuff inhibition, which I've talked about in my other videos, when I talk about wearing a sling and immobilizing the shoulder, and do also, take a look. I did a video on frozen shoulder, which also talks about that. Closed chain exercises can be used, keeping the hand in contact with the surface to ensure a small joint movement to start with, and just encourage proprioception without inhibiting, the recovery. Once pain-free, and the range of motion is restored, then you can start a daily strengthening and stabilizing exercise program, which you can be, advised on by either a physiotherapist or a sports therapist. So we've got kind of different exercises for different sort of stages of the recovery. So I'm going to take you through those now. So first off, we're going to look at what's called the progressive loading phase. So this is where you're going to start exercises to strengthen, stabilize, and improve function, focusing on those rotator cuff muscles, which, as we said, are there to stabilize, the shoulder. And then obviously you will have the perturbation training, which is your exercises to improve reaction times. So specific exercises, for example, for sports such as football, will encourage the shoulder to deal with those sudden impacts. Return to sport, when you're looking at returning, you're going to want to be doing sport-specific exercises to work on muscle balance and reactive stability, and also to increase power within that shoulder joint. It will usually take between about 14 and 30 weeks to return to sport after dislocation, dependent on the type of dislocation, type of surgery, and individual athlete. And again, you've really got to have patience with that, and don't push yourself too hard, because you're not going to do yourself any favours. So in terms of exercises for dislocated shoulders, so you're going to start with sort of working on the mobility. You're going to avoid anything which combines upward lateral rotation arm movements, so anything like that, which is, more prone to dislocation. So let's take a look. So one of the best starting exercises, which you'll be aware of if you've seen some of my other shoulder posts, they're great in the early sort of stages of recovery, are these pendulum exercises. Now, only do these exercises when you are pain-free, and you're going to lean over and gently swing the injured arm forwards, backwards, sideways, while leaning forwards, and also clockwise and anti-clockwise circles of about 1 foot in diameter. And then you can slowly increase the range of motion, just avoid that upward and outward rotation. So then we have these pole-assisted shoulder mobility exercises. So first we're going to work on abduction and adduction. So that's bringing the arm out to the side, and then adduction back towards the body. So you're going to hold a pole or broom handle, whatever, with both hands shoulder width apart, and then you're going to push, using the good arm, you're going to push the injured arm to the side, away from the body, and then back towards the body. And then you can repeat it in the opposite direction. Then you can also, using the pole, work on rotational movements. So again, holding the pole, hands shoulder width apart, keeping the elbows in to your sides, and you're going to move the pole again to the left and right with a slight rotation around the body rather than moving in a straight line. So you're going to sort of create a bit of an arc in front of you. Now, another gentle exercise for the early stage of recovery is this arm assisted flexion. So you're going to grip the hand of your injured side with the good side, and you're going to slowly bring the arms up. So initially your arms will be down sort of by your stomach, and then you're going to bring slowly the arms up, supporting with your good hand to above, towards your head, and then eventually above and over your head. Now, initially you won't be able to get right over your head. So initially you just want to do as pain will allow. And you know, if the shoulder at any point feels like it may pop out, stop there and then return to the starting position. Just build it up gradually. So that's the first stage of these recovery exercises. Now, if you can do those exercises without pain and you feel like you're getting some range of motion back, then it's time to start working on the strengthening exercises. Now again, here we're going to avoid any movements that combine the abduction, which is bringing the arm up away from the body, and lateral rotation, so anything that sort of goes back and away. But these exercises can start once the pain allows, if the dislocation was an anterior dislocation, i.e. the shoulder came forward. Now we're going to start with some static isometric exercises and slowly progress from there. So we're going to start with some isometric shoulder extension and flexion. So for the extension, we're going to stand against a wall with arms by your side, keeping the elbows and wrists straight, and you're just going to push back with your hands into the wall. Then for the flexion, you're going to face the wall this time, and again just push into the wall sort of with your hands. Then we're going to work on the isometric adduction and abduction. So that's movement of the arm away from the body is abduction, and adduction is back towards the body. So for these, you're going to place a small pillow between the injured arm and the torso, and you're going to just squeeze inwards and hold, and then release, and that will work on your adduction. For the abduction, you're going to stand side on to a wall with the injured arm next to it, and then you're going to push the back of the wrist against the wall and hold. Okay, so then we're going to work on our isometric external and internal rotation. So for the external rotation, you're going to stand side onto a wall with the injured arm next to the wall. You're going to bend the elbow at 90 degrees, keeping the upper arm in towards the body. And you're going to push the back of the hand against the wall and then hold. and then release. For the internal isometric rotation, you're going to stand side onto a door frame with the palm of the injured side facing the frame. Again, bend the elbow to 90 degrees, keeping the upper arm in towards the body, and push the palm into the door frame and hold, and then release. Now, once you can do, the isometric exercises comfortably, you can try doing the internal and external rotation, abduction and adduction, and flexion exercises using a resistance band. Again, so pulling in towards the body and then pulling away from. And for the abduction, adduction and flexion, you can just basically use one end of the band under your foot and then just lift the arm up and away from the body. And adduction, you can maybe pop it around a door handle of a closed door and just pull across the body. And then obviously flexion, pulling it up in front of you and back down. That's going to be flexion and extension. So then, once you've completed the strengthening stage with these isometric exercises, you're now going to look at the more functional exercises, that are basically designed to replicate everyday movements or sport-specific movements. And these are for the advanced stage of rehabilitation. So do check with your GP or physio, sports therapist before you start. So some examples of these functional exercises are wobble board exercises, which are quite common with physios. And these are basically to improve joint awareness. So, for example, you could start on all fours, hands on the wobble board here, and then you're just going to sort of push down and then back up, keeping the balance on that board. Now, you can also initially, if you're not strong enough yet to sort of do any kind of push-ups, and they will be mini push-ups, while maintaining that central position, then you can start by just holding the board still for a minute without any push-up type movement, or performing circles with the board in a sort of controlled manner. And once you can do that, then you can start trying to do mini push-ups while maintaining the central position of that board. Now, the next one is using a Swiss ball or gym ball, and this will really help with shoulder stability. So this will work on the core muscles as well as shoulder stabilisation. You're going to balance on the ball at the hips, and again, you can place the hands on a wobble board, maintaining balance while moving the arms. And then finally, you have these rebound exercises which work on dynamic strength. So you're going to stand facing a wall and throw a light ball at chest height and then catch it again. And then you can progress with a heavier ball using only the injured side, or maybe by throwing higher, just to work the shoulder a little bit more. So that's really all for shoulder dislocation. Hopefully I've given you a better understanding of the different types of dislocation, how to prevent it, and also how to treat it if you're unfortunate, enough to get this injury. And hopefully the stages of the rehabilitation are clear with what you should be focusing on. Like I've said, you do need to be patient. Don't try and rush on to the next stage of the rehab exercises, because all you're going to do is increase your chance of having another dislocation, which second time round could be worse than the first and keep you out of your sport for even longer. So, as I said, I have got other shoulder posts on things like slap tears and frozen shoulder. So if you think there may be an element of that in your injury, do take a look at those. You can subscribe to my channel and you'll see all of the other available videos. And feel free to comment down below or do contact me through my Facebook or Instagram, and I will come back to you and answer any queries that you might have. Yeah, that's really it from me on this topic. So there will be more videos to come, but until next time, that's all from me. So take care, and I'll see you next time.